everyone. My name is Dr. Janani Krishnaswamy, and I'm here to answer your questions about being a doctor. I am currently a physician practicing internal medicine, preventive medicine, and lifestyle medicine in a clinical practice. I also am a content author at UWorld, working on online preparation for the U.S. medical licensing exam, the major examination taken by all medical students in order to become a doctor. You all sent in so many great questions about what it takes to work in this field, and I'm excited to answer some of these questions for you. So let's get started. How many years of school does it take to become a doctor, and what degrees do you need? So, in order to become a doctor in the United States, this is the process. You typically will major in something in college. You have to take a requisite series of courses that prepare you for taking the MCAT. The MCAT is the entrance exam for medical school. So depending on what kind of university or college you go to, whether it's counts AP credit and how many credits you transfer in and whatnot, it can be anywhere from 2 to 4 years in order to do that undergraduate degree. Now, there are some programs out there that offer you a combined acceptance from undergraduate and medical school, and those can be slightly different. But typically, you're looking at about 2 to 4 years at a minimum of undergrad. So you can get any degree that you want. It does not need to be a science degree. I did not have a science degree. I had all liberal arts degrees, and honestly, you can choose whatever you want as long as you get those requisite courses in for taking the MCAT. After you get into medical school, it's 4 years of medical school. So and it's different from school to school, but typically the first 2 years, you're studying the basic material. People compare it to drinking from a fire hose. There's a lot of material that you just have to learn about the human body and disease and illness and all of these things. In addition, you have 2 dedicated years where you're seeing patients, and that's, typically your 3rd and 4th year. You're rotating on different specialties like pediatrics and internal medicine and surgery and OBGYN, and you're taking care of patients in a team setting. Schools will organize this differently. Some medical schools allow you to see patients from the first year itself in combination with the learning and the didactic material. But give and take, it is 4 years of medical school. Once you complete that, at your 3rd year and periodically in your medical school, you will be taking those entrance exams, the STEP exams, which are the United States Medical Licensing Examinations. This is what at UWorld, we write questions and prepare content for people that are preparing to take those examinations. They are very intense examinations. Lots of questions, very difficult, but very doable with UWorld material. After you pass those exams, you enter residency. And residency really depends on what field you're choosing. Internal medicine, which is what I did, is typically 3 years. I also did a preventive medicine residency, which added an extra year on. But other fields may have anywhere from 5 to 7 years, depending on what the specific training is. And that's, something that can be determined once you find out what your passion is in medical school. You can also keep going after residency and do fellowship. So those super specialized, pediatric cardiologists or, plastic surgeons with a specialty in facial plastics and things like that, that is a lot of education and a lot of training and a lot of fellowship. Sometimes it can take as much as 10 to 12 years, depending on how specialized you want to be. But at the very minimum, you're looking at least 3 years of residency for most specialties. So that's how long it takes to become a doctor. What is your favorite thing about being a doctor? Well, I really, truly do love being a physician. I think that you may hear people who practice medicine, you might hear it in the media that doctors are burned out and that we deal with a lot of stress and it's a really stressful career, and all of that is true. Burnout and depression and things like that affect doctors just like they do everybody. But it's important to separate the practice of medicine from being a doctor itself, right? And the my most favorite part about being a physician is interacting with people and truly, as cheesy as it sounds, helping people feel better. And that doesn't necessarily mean curing cancer. It could be as simple as having a conversation where I really listen to what's going on and offer empathy and support. And that is truly so healing. So every day I have the capability of offering empathy and providing healing. And that's such an amazing privilege to be able to offer that. Not every day goes great, and there are lots of days where I wonder if I could have done a better job. But it's the idea that in my profession, I'm dealing with people who are at their most vulnerable state. People who are experiencing illness, discomfort, sadness, fear, and worry. And I have the ability to at least sit with that, help them work through that, and offer potential solutions. And I love offering solutions. Even if the solution isn't necessarily curing them overnight, helping someone get better the next day, a solution could just be how we choose to think about our condition. And it's that education and that form of teaching that I really love about medicine. What classes, clubs, or extracurriculars do you recommend taking in high school to become a doctor? So this is really important. There is no cookie cutter set of classes, clubs, or extracurriculars to take in high school. The key is focus on what you're passionate about. Find your passion, and then the activities and things that you want to do will naturally become clear to you. Rather than trying to look at what schools will like and choosing it based on that, I will tell you, as somebody who has sat on admissions committees and looked at hundreds of essays and applications, it is very easy to spot somebody who is purely choosing activities because they want them to look good versus somebody who really has a passion and has built something around that passion. So you probably heard people tell you this before, but really and truly find out how you want to make a difference, and then choose the classes, clubs, and extracurriculars around that. Obviously, you do have to take your requisite classes to graduate, and you always want to do those. But if you, for example, love tinkering with circuits and physics is calling you, by all means, if you're more a world history buff, do world history. It's not like there's one cookie cutter formula to get into medical school. The only formula is to work hard, put in your effort, and just choose what you're passionate about. That's all the time we have for questions. I hope this was helpful. Everybody at UWorld wishes you all the best in your future careers, and good luck.